Hello everyone, my name is Garima Srivastav and I am doing master's program in business administration from Liverpool Business School in affiliation with Upgrad. First of all, thank you very much for giving me opportunity to pursue this program from your university. And I got opportunity through this program. I got opportunity to make a comprehensive analysis for healthcare solution in India. So let's get started with our final thesis presentation. So in this presentation, I am going to emphasize about introduction about healthcare industry in India and what are the problems about it and its solution. I would also look at the literature review and aims and objective about it. I have also collected data of about around 25 people and I would provide a summary about it. I would also provide details about requirement analysis and methodology, and then finally we would go towards the results and conclusion. India's healthcare system plays a crucial role in ensuring the well-being of its vast population. However, it faces numerous challenges that hinders its ability to provide accessible, affordable, and quality healthcare services to all the citizens. So there are certain problems which Indian healthcare systems are facing, which is like transportation problem, poor sanitization, and uh, and lack of certain equipments. These are the top three major problems too. And after the completing my comprehensive analysis on the current Indian healthcare system, I came to a solution. If we go through an online solution, if we create a mobile application or web application for the connecting the patients and connecting the doctors or physiotherapists or any other medical providers, it would be a great thing for Indian healthcare system. So for that I came up with a solution which I am going to create a healthcare mobile application which is called as PAT Health. PAT Health is nothing but Patient Health Mobile Application. And its key features are about scheduling, effective scheduling, visitors tracking. Initially, I am going to cover approx 10,000 patients in that, and its expand. I'm also looking at its expansion to the global market. Reasons for healthcare mobile application growth. So there are various reasons why mobile application is required. One is limited healthcare facility. So if we have mobile application, using that we can reach to any market in a second. And poor sanitization. So going through, if we go through a mobile healthcare solution, then there will be less chances of getting infected. Transportation challenge, high cost of medications and cheaper internet. I had studied some literature regarding some journals related to healthcare, and I came to certain conclusions. Here are they. Healthcare infrastructure, first was that point. India has a vast and diverse healthcare infrastructure ranging from well-equipped private hospitals and clinics to government-funded healthcare centers in rural areas. The healthcare system compromises both modern medicine and traditional practices like Ayurveda, yoga, and naturopathy. So these Ayurveda centers are, let's say, if in one state of India, and if someone wants it from another state of India, then it becomes very costly for them. So, however, if we go through an online channel, it would be very feasible and cost effective both. Medical tourism, India has become a prominent destination for medical tourism, and due to its cost effective healthcare services, people are coming to India for treatment from all over the world. Pharmaceutical industry. India has a robust pharmaceutical industry known for its generic drugs manufacturing capabilities. It supplies a significant proportion of generic medicines worldwide, making healthcare more affordable in India and globally. Healthcare challenges. Despite progress, India faces numerous challenges in its healthcare sector. The healthcare infrastructure is often inadequate, and especially in rural areas, it is leading to disparities in access to the quality healthcare products. At technology adaptation, India has been adopting digital healthcare solutions, telemedicines, and various other innovations to bridge the gap between the urban and rural healthcare accesses. Let's move towards the problem statement. Why there has been many efforts for creating mobile healthcare apps before, and but after a while there was a decline in the healthcare in creating the online healthcare system. So first and foremost reason was the inadequate medical equipment and technology, poor sanitization and hygiene, accessibility and geographical disparities. People had lack of interest in feeding the data in mobile application, and transportation challenges where there too. These are the reasons in decline in online healthcare system. Next is about my aim and objective towards the research. The aim of creating the Path Health is to be an innovative solution that offers an all-in-one approach to manage the general physicians and musculoskeletal complaints through virtual and in-person care. So basically it is a transition between in-person care to the virtual solutions. The objectives, so I have kept basically top three objectives. Number one is to examine the key factors that impact the attitudes of millennials towards the online patient management. Number two is about to explore and study the path health and to provide the top-notch general physicians and patients and MSKs together. Number three is to analyze the influence of internet-based technologies. Okay, let's start with data analysis. Data analysis plays a crucial role in an online patient management system as it can provide valuable insights for improving patient care, optimizing workflows, and enhancing overall efficiency of the system. So the first chart is this is a pie chart, and it's telling about the age-based patient demographics. It's telling that approx 55% people over the age of 50 years are interested in online patient management system. 40% people between the age 30 to 50 years are interested in online patient management system, and approx 25% people between age group 18 to 30% are interested in online healthcare solution. Let's look at the second patient demographics. It is about gender-based patient demographics. So I had made a market research of around 25 people. Into that, I got to know that approximately 75% females are more interested in creating the online patient management system, and approximately 45% male are interested in having online medical solutions. Thank you. So this is patient demographics 3, and it's telling about the preferred mode of health checkup. Approximately 80% people are interested in online booking, scheduling, and interacting with the doctors online rather than going to the clinics. So the market is changing. This is patient demographic number 4, which is telling about the cost management, about managing the finances, about the paperwork. So people are more interested in doing it online, approx 75%. However, 25% people said that they want it to go to be still to be on paper. So let's talk about requirement and resources that are required to create a PAT health solution. So that there are certain hardware and software requirements. First is Java, the development kit, that is JDK 8 or above should be installed in your laptop. Second is Microsoft Windows should be approx 7, 8 or 10 or above. Third is about the space. It should be 8 GB recommended, and the screen resolution should be between 1280 to 800. And there are some requirement about the resources too. So I have tried to take care of all kinds of patients, like grandma Ria, which is not that tech savvy, so she would want to go through one online system which is very user friendly. The second one is Ryan, who is very tech savvy, so he can go through some expert solutions through. And the next one is about the Kabir, who is a bit tech savvy and who is interested in some financial solutions. So in this way, it is basically mentioned in the thesis too. So I have taken care of different kind of patients and their interest. And the another resource is provider, which is basically a doctor, and PT, which is a physiotherapist. And another required resource is about concierge, which are basically the caretakers. And the next is case manager and the people for billing. All right, so let's talk about methodologies that is used for this research. So I am actually creating a mobile application which is PAT Health, about the patient health. And for creating this mobile application, I have gone through software development lifecycle process, that is SDLC. So that has various phases like requirement gathering, and then development, coding, implementation of those codes, and then finally release. And after code, there is definitely a code review too. So I had started with the analysis and the market research, by using around 25 people data. And so I have created some of the patient demographics, which actually helped me to know about the various challenges for creating the app. And the next is about the technology that is used to create the software. And the technologies that is I have used are for front end development, it is HTML and JavaScript. For back end development, it is Python. And for APIs and integration, I have tried to make a research and provided the best channel. And for database, it is MySQL. And I also came up with a solution of by creating the several minimum viable products, such as account creation, scheduling, patient work, paperwork, virtual visit, and HEP, which is like home exercises plan. And finally, let's move towards the release and the result part, which is about having a seamless transition from the in-person care to virtual care. And having an outstanding patient portal about the healthcare solution. This picture depicts about Path Health mobile application and web applications, users, user access, modules, integration interfaces, and external functionality. The users are patients, doctors, physiotherapists, concierge, which is caretaker, case manager, and billing. people and the user. There are two types of access which would be required. One is through the patient who would be logging in, and the second one is through the care management. So basically one is the admin login and one is the consumer login, which is called as patient portal here. The modules which are required to take care here are account creations, scheduling, virtual visits, and there would be a module for patient admin, PPW, and also there is a module for home exercises plan and billing and home exercises and reporting and analytics, where all kinds of reports would be taken care, and the patient engagement and better gamification. The integration interfaces that we are going to use are robotics process automation and platform APIs, HL7, which is like healthcare technology. We are going to use that. FHIR APIs also we are going to use. So these are some technical terms that I have added here, and it is also mentioned in detail in my document. So the external functionality that are required are about patient scheduling and admin and electronic medical health records that we are going to create, payment system, feasible and easy payment system. There would be some common services provided to both payer and provider, which is like patient and the doctor, which is about the authentication for safety purpose, video conferencing, omni-channels. Omni-channels means patient can contact the doctors through various channels like emailing, chatting, calling, or video conferences. And there would be some process automation too. So after going through all these, we will definitely look at the results. The results are about the having the seamless transition from virtual to in-person care, about having an outstanding PAT health application and patient portal and care management portal, and it would definitely provide us the patient self-registration and ability to upload profile and preferences. It would give us a channel to schedule a virtual visit, upload the pre-visit paperwork including the pre-visit assistant, and attend a virtual musculoskeletal therapy session. And also it would give us a channel to physiotherapist and the paid physiotherapy related patients to do some home exercises plans. And it would also give us some opportunity to look at the data and interact with both payers and providers. So let's look at the discussion part. Mobile application plays a vital role in building the gap between the healthcare providers and patients. So thereby I have gone through certain points which I wanted to discuss today is about the telemedicine and remote consultations. Mobile apps enable virtual consultation, allowing patients to connect with the healthcare professionals anytime and anywhere. And appointment scheduling and reminders. Mobile apps provides convenient a platform for patients to schedule appointment and reducing wait times and enhancing access to the healthcare provider. Geolocation and mapping. Mobile apps can leverage geolocation services to help users find nearby healthcare facilities, clinics, pharmacies, and emergency services. Health information and education. Mobile applications provide access to reliable health information, enabling users to educate themselves on various health topics, and which would be about the seamless transition from in-person to virtual healthcare. So here are some conclusion about my comprehensive analysis of healthcare solutions, which is like essential to tackle evolving challenges faced by the healthcare industries. By embracing these kind of technological integrations, we are prioritizing the patient-centered care and focusing on preventive measures, enhancing the healthcare accessibilities, and strengthening healthcare infrastructure, ensuring data privacy, and promoting collaboration. Healthcare system now can move towards a more efficient, equitable, and patient-centric approach. Advancements in healthcare solutions have the potential to transform the lives of millions of people and provide them the better health. Through collective efforts and a commitment to innovation, we can create a brighter future for healthcare that addresses the needs of all the individuals and the communities. So let's look at the second phase of the research, which is like future work. So I would like to, in the if I get the opportunity to research again, then I would like to definitely look at its market research kind of thing parts, because there my question would be, can new PAT health launches and strategies deployed in Indian healthcare with support from Indian government turn the tables to capture the market? So let's come to the research reflection. Thank you for listening me. So by doing this kind of research, it has definitely enlightened me, and it has definitely transformed my journey into the digital healthcare industry. As I reflect on the entire process, I am compelled to share my thoughts, experiences, and lessons learned throughout the research endeavor, and the reflection highlights the challenges faced, the moments of inspiration, and the insights gained during the process of conducting the completing my thesis. Creating an effective and inclusive healthcare system in India requires a multifaceted approach. By strengthening primary healthcare, addressing the healthcare workforce shortage, expanding health insurance coverage, promoting preventing healthcare, embracing technology and innovation, and investing in a good way. So thank you very much. Thank you for listening me. For do reach me or email me if you want to get any more details on the same. Thank you.